Hey guys, welcome to Pancreas Pals. Emily here, and this week we have Dr. Mark Heyman. He is the CEO of Center for Diabetes Mental Health and author of Diabetes Sucks and You Can Handle It. And also, he has his own podcast, the Diabetes Psychologist Podcast. Welcome, Dr. Heyman.
Thank you so much, Emily. Good to be here.
I'm excited. I actually got all of that title out, but I'm happy to have you. Miriam is still on what we're calling maternity leave, so I'm so excited to have a mental health expert sitting in this chair with me for this week. To start out, our spiel is always about our diagnosis stories, so I would love if you could share yours if you don't mind.
You bet. So I was diagnosed with type 1 diabetes on June the 1st, 1999. I was a third year in college and just finishing up my junior year. And the thing about my diagnosis was I'd been studying French for a long time, and I had gotten an internship at the US Embassy in Paris for the summer. And so right before the summer started, I got really sick. But I didn't wanna admit that I was sick, and I certainly didn't wanna go to the doctor because I was convinced that the doctor would tell me that my trip to Paris would have to be off, and I didn't want that to happen. So, I mean, looking back on it, that was a little bit silly. Not that my trip to Paris could be off, but the fact that I was extremely sick and that I was being stubborn and not going to the doctor, because of that. Anyway, there came a point where I just couldn't function anymore. I remember walking to class, trying to walk up a hill, and I just couldn't make it. And I went to the student health center, and I told them what was going on, and they called me back into a room, and the doctor checked my blood sugar with a finger stick, and it said high. And I was thinking, well, high, medium, low, high is not that big a deal. But he goes and he looks up in the little manual of like what the glucose meter, um, what it meant, and he figured out it meant over 600. And he kind of I don't think they've ever seen someone that sick in the student health center at my college, and so he literally shoved me into a chair, called an ambulance, and sent me to the hospital. And I'll tell you the most humiliating thing about it was the student health center was on one end of a quad, but there's no car access. So they had to wheel
Oh
me across
no.
this big quad at my college, and I was just horrified. Long story short, I went to the emergency room. They diagnosed me with type 1 diabetes, and they sent me home. And they said, "You go see an endocrinologist tomorrow." And they made me an appointment. So I went home and I remember I had Chinese food, had some
Oh
Dr. Pepper.
God.
They didn't tell me what to eat. Um,
Right.
but I went home and I was like, I'm just gonna eat whatever I'm gonna eat. So I don't think they gave me insulin. They may have. I don't remember
Oh
that.
no.
But I had an appointment the next morning with an endocrinologist. The endocrinologist, thank goodness, was a woman named Ann Peters. And if you don't know who Ann Peters is, she's a very well-known endocrinologist in the LA area. She is famous for seeing patients who are Olympic athletes. I think she's Nick Jonas's doctor. I mean, now she is. At that time, Nick Jonas wasn't a thing.
He
And
was like 1 years old.
exactly. But luckily, I got assigned to her, and she sat with me for probably 2 hours that
Oh
morning,
my
kind of going over
gosh.
diabetes and like helping me to understand at least from a very high level like what I had to do. And at the end of our appointment, she said to me, "Do you have any other questions for me?" And I kind of timidly said, "Yeah, I do. I'm planning to go to Paris in 2 weeks, and I guess I have to cancel my trip." And she looked at me like I was kind of crazy, and she's like, "Why would you have to do that?" So 2 weeks after I was diagnosed with type 1 diabetes, I got on a plane and flew to Paris and spent the summer there. And
That's amazing.
it was awesome. And I have to tell you that that experience and her really empowering um, message that she sent me has just stuck with me. That diabetes doesn't have to get in my way of doing anything, and that I can do it. And I that's really stuck with me for myself, but also it's a message I try to send to my patients because we get so many messages about diabetes from all over the place, including our doctors, about how it has to get in our way and how things can't be easy. And I just don't think that's true. I mean, not that diabetes is easy, but that we can't do everything that in life that we want to do, even if we have diabetes. And the
I have
great thing
so
is
many questions for you.
I sent Dr. Peters a copy of my book because she's in
Amazing.
it. I mean,
Oh, okay.
that story's in the book, and I got a very nice note back from her. Just like it was very. It's like I'm so proud of what you've done,
Oh,
and so. yeah, it was really kind of heartwarming.
I love that. We actually have a lot of similarities between our diagnoses. I head back to season one, episode one, listeners, to listen to my full diagnosis story. I always seem to make episodes about me, but here we are. I'm diving feet first into this one. I was diagnosed in between my sophomore and junior year of college, and I too was like walking. I remember sitting through a lecture, getting up to pee every like
Mhm,
5 minutes. And I went to the health center at Boston University, and I'd already been being I had been monitored for what they had told me I was pre-diabetic for about 2 years. I had a weird diagnosis, not from my college university, but from my hometown. It was like a whole thing. But I ended up getting on a plane 2 years, 2 days after my diagnosis and going to New York, which is very different than leaving the country and going to a place where, they don't, you don't, well, sounds like you did speak the language, but, it's just, I remember thinking like, looking back now, I'm like, how the heck did I do that without knowing much at all about diabetes? But I ended up getting amazing healthcare here in New York. But like, just as someone who was diagnosed in 2014, I had so much access to all this technology. And I remember I ended up getting a Dexcom and an insulin pump within like 6 months of my diagnosis. My insurance
mhm,
actually made me wait that long, like, which is a whole other thing. But I'm curious, and not to like
mhm.
outdate myself, but what was it like in the 90s? Because I mean, like, it took longer for, I know you're probably going to kill me. You are effervescent, you're not old at all, but I'm very curious as to know, like, how did that differ, A, from your diagnosis, but B, then going to Europe, which was it different there at that time too in the technology?
Well, we didn't have technology at that point.
Right. Like, were
I
you
mean,
doing dip tests?
I should say, we had technology, but it was very it's obsolete now. So we
Primitive,
didn't
yeah.
have the we I mean, we had glucose and this isn't the dark ages because I mean we can go back to the dark ages of diabetes in the 70s and 80s and
Right.
even before that. But when I was diagnosed, we had blood glucose meters. It took about you had to have a big drop of blood and took about a minute to get the
Minute.
results. So we had you checked them and you had to wait and wait and wait while it counted down and gave you a number. And test strips were and still are very expensive, and so we got two or no, three or four of them a day. I think the biggest difference was actually though the insulin that we were using.
Right.
When I was diagnosed right before Lantus came out. So
Wow.
I was using NPH and regular. And for those of you who don't know, NPH is a long acting insulin, but basically it's an insulin that it's regular insulin, which is the precursor to like Humalog and Novolog, but it was basically that mixed with a chemical that made it cloudy and that made it last a lot longer. But the thing about that insulin, and you may have heard these stories for those of you who are younger, of people with diabetes having to keep a very very strict schedule. They have to eat at 6 a.m. and noon and 6 p.m. And the reason for that is because of NPH. NPH peaks. So you take your insulin, and 4 hours later it peaks, and so if you don't eat, you'll crash low. So I think that was the biggest challenge of diabetes at that time for me. Soon after I got back from Paris, I actually got put on an insulin pump, and I've been on an insulin pump ever since. And But for many years, I was checking my blood sugar frequently or infrequently, and then I got put on a Dexcom in probably 2013, I want to say.
That's
So
awesome.
and for me,
Yeah.
that was a game changer. As is for everybody, but it sounds like you were very lucky that you got put on desktop right away. So
Yeah.
I had to learn how to manage my diabetes using a stick shift, and you got to use an automatic right away.
I know I'm like a Tesla already. But, I do think that, even I just Miriam and again, Miriam and I discuss this all the time because she was also diagnosed in the 90s, but she was like probably 10. I can't remember. She was like 6 to 10. So she was really little, so she doesn't remember a lot of her care. Her parents took care of her until helped with her care, all that stuff. I was diagnosed at 20, so for me it was, always just me doing everything, and I'm
Mhm.
not complaining. I'm glad my mom didn't have to stress about that, but I think it is very different thinking about the technology and all the stuff that's come out, and also me being the one having given care similar to you, doing all of your own care. Um, but that experience sounds wild. I'm very impressed with you going to Paris, but also I mean, technology is huge. So there's so much I want to ask you. That was kind of like the first things that came to my mind when you told your diagnosis story. But let's talk a little bit about your path into mental health and how this book came about.
Okay, so that's
You're
a long
like, yeah.
that's a long story. Uh, and I wish that I could give you a really good, like, solid, like, step by
Answer.
step process. But so when I was diagnosed with diabetes, I was in a third year at UCLA, and I was studying political science, and ended up graduating with a degree in political science. And somehow, and it was after my diagnosis, although I can't tell you that it was actually directly related to my diagnosis. I decided to change paths, and I really wanted to go into psychology. And I don't. I wish I could say yes. I've always wanted to do what I wanted to do. What I'm doing now. That's not actually true. But what happened was, if you, for those of you who don't know, getting into psychology grad school is really competitive, and you need a really good story. And I had diabetes, and that diabetes kind of became my story, and then it became a self fulfilling prophecy. So I kind of said I want to go into I want to go into mental health and study psychology so that I can, because diabetes is a big deal. It's underserved in the mental health field, which was true then, and certainly and it's still true now. And that's what I want to do. And I thought, oh, that would be a good story, and it was. It got me in grad school, and then I realized it was actually a really good story to actually continue on with. And so that's kind of the path I took. I took some detours along the way, which were actually great for me to learn how to see patients with all kinds of different challenges. Because I think that the reality in the world of diabetes and mental health, certainly we have diabetes specific challenges like, burnout and fear of low blood sugar and diabulimia, which we see a lot, but those don't exist in a silo. You have to be able to, see people who have lots of other challenges, including diabetes, and be able to help them. And so getting a broad range of clinical experience was extremely helpful for me.
That's very interesting. I actually, and I talk about this a lot on the podcast. I see a psychiatrist who's also a type 1, and she
Oh,
specializes, shout out to Dr. Schiffeldrum in New York. But
I know her.
Mir yeah, well, she's my y'all can talk about me later. But she's my doctor. I've been seeing her. I actually had an instance. I've always suffered from anxiety, and I'm like
Mhm,
chicken and the egg. Like, it definitely came to a head when I was diagnosed with type 1, but
mhm,
long, long been an anxious human. Got some OCD thrown in there just for fun. So I was having a lot of issues with like insulin, like getting past the mental block of giving myself insulin and like all this kind of stuff, and she's been super helpful. But I know Miriam also is a type 1 diabetic, and she's a licensed mental health counselor, and that played a huge role in her career choice, especially because it is so underserved, which is wild when you look at all the different types of diabetes and how big of a population has to deal with this. I know type 1 is just a facet of that. I think it's something like 5% of all diabetics are type 1, but everyone who's diabetic has their own battle, no matter what kind you have. So I'm curious, do you see a lot of type 1 specifically, or do you see kind of like the gamut?
I only see people with type 1.
Amazing.
I,
Okay,
I will not
so
see people. I will not see someone who does not have type 1 diabetes. I mean,
that answers that question.
and not because I'm discriminatory, but because I can't help them. My
Right.
expertise, like, just like you wouldn't go see uh, um, a dermatologist if you had an earache. You wouldn't
Gotcha.
go, and a dermatologist wouldn't see you for an earache unless
Yeah.
it was a drastic emergency. I'm not going to see somebody who doesn't have diabetes because I cannot help them in the best way possible.
Gotcha. And there are specialists out there who do. So, I mean,
Oh yeah.
there's a lot. And, anyone who has a different type of diabetes knows that there are different struggles with each type. So it's
Hmm.
definitely not a one size fits all for sure.
Nope.
But when it comes to your book, I love the
Hmm.
title, by the way, everyone. It is Diabetes Sucks and You Can Handle It. I'm pretty sure we all need that on a t-shirt. But how did writing this come about? Was this a culmination of your years of experience? Was this you having a bad day and being like, okay, someone else needs to read this too?
So I've been trying to write a book for a long time, and for any of you who've ever tried to write a book, it's a challenging thing because you have to have a very clear message that you want to be sending. And I realized, kind of through lots of fits and starts, that the message that I had wasn't extremely clear. Like we can write a book about diabetes and mental health, but that's way too broad. And so one day, I remember this day very well. It was about a year and a half ago. I had a patient come into my office to see me. He's a young guy, just out of high school, and he said to me something like, "Diabetes sucks." He actually said it's fine. He said diabetes sucks. It wasn't something like that. He said diabetes sucks, and my response to him was, "Yeah, and you can handle it." And no, I think I said, "But you can handle it." And then I corrected myself and I said, "No, and you can handle it." We can't say but, is there's not it's not an either or, it is an and. And I was like, "That's my book. That is the book." And literally after he left my office, I sat there and I outlined it out of, okay, what we need to do is we need to write a book, or sorry, not we. I need to write a book that um that really like is honest with people that diabetes is challenging, because the worst thing we can do is tell people, oh, it's not that big of a deal, or let you believe that's not that big of a deal, because you're not doing yourself any favors. Because if you say it's not that big of a deal, and pretend like it's not when it really is, you can't address it, you can't do anything about it. But at the same time, what I see a lot in my work is that people make it a much bigger deal than it has to be. They say things like, "My life is over because I have diabetes." And that's just not true. That's a story we're telling ourselves. And so the first goal is to bring people into this place of honesty. Both the diabetes sucks, however, it probably doesn't suck as bad as you think it does. Or sometimes, or as you make it out to, especially on those bad days that we all have. When we all make it suck, or when diabetes makes it suck, and also we all make it suck in our minds more than it has to. But then after being honest, like I realized we need to give people a clear path. Okay, so you've been dealt a bad hand of cards. So what do you do about it? How do you handle that bad hand of cards? And so the rest of the book really focuses on, okay, so we have this thing that sucks. How do you handle it? How do you deal with it in a way that doesn't make things get in your way? Just like my doctor gave me that message when I was diagnosed about I can go to Paris even though I have diabetes. How can you do whatever it is you want to do, even though you have diabetes? But that takes skill. It's not okay just snapping your finger and say, I'm going to do it. It takes a lot of skills to be able to learn to handle the stress of diabetes, because it is stressful. And so the book really paves the path for people to be able to learn those skills and practice those skills on a regular basis so that they can handle diabetes.
Now, a word from one of our sponsors. Hey, Christy, have you heard of US Med Supply?
I think I've seen a commercial for it. It's a medical supply company, right?
Yeah, but apparently they're the #1 distributor for Freestyle Libre systems nationwide, the #1 specialty distributor for Omnipod Dash, and the #1 fastest growing tandem distributor nationwide. Plus, they're rated as the #1 distributor in Dexcom customer satisfaction surveys.
Ooh, sounds like something I need to check out. Do they partner with most insurance companies?
Yep, and they'll even help us get set up and work with our insurance companies so we don't have to spend hours on the phone.
The actual dream.
Right? We and all of our pals can head to usmed.com/pals or call 888-721-1516 to sign up now.
Already on their website.
And now back to the episode. Apart from, and I do want to get into a little bit of, not full specifics because we want people to buy the book, but some of the input there, like actionable paths. But
Mhm.
what in your life, aside from Paris, or maybe it was Paris, was your moment realizing, have you had multiple moments like diabetes sucks and I'm running a marathon and I'm doing this? Like what are those moments that have stood out to you? I know I have a few. But it's so cyclical, mental health. Like it's like you can
Yeah.
really master and like come to terms with something, and then boom, something happens and you're like back to square one, but you have to work back through that and remember all the things that you've learned.
So
Um,
I mean, I can tell you lots of stories about how diabetes has sucked for me from the time that I remember, and when at my first job out of college, my blood sugar went really, really high during a meeting, and I just bombed the meeting. And then my boss got mad at me because she didn't know what was going on, because I didn't tell her what was going on. So like she had
yeah.
no knowledge about the fact that I was like, feeling awful, and so she thought I was just like a lazy employee.
Yeah. Oh, no.
um,
Yeah.
to times when I've had really severe low blood sugars, and like it's been really scary for my family and my friends. So there are lots of those challenges, but then to see that I've been able to get past that, and to go through it, and not let those things, not hold on to those challenges, but to see them what they are, and then to be able to let them go and to be able to continue moving on and not letting those things hold me back. I mean, I do lots of adventurous things. I mean, I scuba dive. I went skydiving many years ago.
Oh my god.
I yeah, that was a one time thing, but
You made it.
I had run a marathon, and I don't say that to brag at all, but I just want I do those things, and diabetes doesn't really kind of come. It's not front of mind when I do those things. It doesn't say,
Right.
oh,
It's not a brag either. You could be proud.
how can I do this if I have diabetes? It's like, okay, well, I'm gonna do this, and I had diabetes, so like, how do I just make sure that I stay safe and make sure that I am able to do it in the best way possible?
And is
So
that kind of
I can't,
something that your book shows too?
yeah, I mean, my story is throughout the book, and so I talk about all the challenges that I have, and just by the way, I do this for a living. But my diabetes management is far from perfect. And I think that's important for people to know that, and I'm happy to share with you or share with people my, my Dexcom data. Because I want, and I show it to my patients all the time because I want them to see that, you know, perfection is not the goal here. And it can't be for any
Right.
of us because if it is, then we're all going to be failures. And that's
Exactly.
not what we want to have happen.
For sure. And I think that, I mean, I have a strict rule because we get a lot of DMs on Instagram asking, like, oh, well, what's your A1C? What's this? And I'm like, I have a strict rule where we don't share because I don't want any of my listeners to compare themselves. Like,
Yeah,
also, my A1C one part in my life is not always the same as it is in another part in my life. We're all on our own
exactly.
journeys. Like, also, what even is an A1C? I'd rather look at time and range. There's like
Right.
all these other things. So,
Yeah, and by the
um,
way, I won't share my A1C, but I will share, like, my daily graph, just to
yeah.
show people
Oh, yeah, for sure.
to show people a snapshot of, okay, well, what does Mark's graph look like today? It's not a straight line. It is
No.
all over the place.
And I
Um,
do think that social media kind of amplifies that, where at least you see it, or I see it on my feed, which has made me take many a break from our Pancreas Pals Instagram account for my own mental health. But people just a lot of times post the good days, and
mhm.
it's not all like that. Like, yeah, if you zoom in 6 hours, oh my God, what a flat line. But then you zoom out 24 hours and it's like, what did she do today? And it's like, I
Right.
lived a fulfilling life today, and at the end of the day, that's what I want to take away.
Mhm.
Obviously, I don't want that to add up into, like, not being on top of things forever, but there it's give and take. And I think I don't know if you've how you feel about social media, because I remember when I was first diagnosed, there really wasn't a community online. Like, I think Instagram came out a few years after I was diagnosed, and I Christy and I, my original co-host, and I started this podcast for one of those reasons, because we didn't really have a community. And it's really helped us, but also there's a lot online that's like, what's going on? So do you have any, as a mental health practitioner, do you have any tips on managing online presence in type 1 diabetes?
Yeah, I think I'm actually a big fan of it for the most part with some boundaries. Because when I was diagnosed, we didn't have any of that. And I felt for many years, I felt alone myself. And until probably about 10 years ago where I started meeting people with diabetes and really getting into the community and doing the work. But I also think it's important to check yourself and to be careful with who you follow and also how much stock you put into what they're saying, because as you say, it's not all sunshine and roses, and it can't be. And anyone tells you that it is either lying to themselves or delusional, and that's just not realistic. But I think I've actually seen a lot of value in social media for that same reason, because people feel so isolated and so alone and like no one can understand them. And what a great way to be able to easily and accessibly not feel that way, to be able to feel like you're connected and to feel like you're not crazy
For sure.
in
I
that
feel like
process.
I feel like gaslight myself a lot of the time with feeling a little like, I'm seeing what other people are doing and I'm like, oh, then I must be doing something wrong. And then it's like, no, that's not how it works. But during the pandemic, especially, not being able to do diabetes meetups with our pals like we used to do in New York, and not being able to see friends for a while during those last however many years,
Hmm.
I do find that there's a lot of bonuses to social media. So
Yeah.
It's
When I when I
wild.
when I meet a patient for the first time, one of the questions I always ask them is, "Who else do you know in your life that has type 1?" And I would say 70 to 80% of them say, "You're the first person I've ever had a conversation with who has type 1." And I said, "That has to change." You don't need to have a best friend, you don't need to, like, dive into the community and all you do is diabetes, but you need to know other people with type 1 just so that you know that you are normal and that your experience is not outside of the realm of what is normal, because so often people come in to see me and they say I my blood sugars are out of control and I my time in range is awful at 65%. And I laugh at them because 65% is actually pretty good. Without context and without having community to know what that's like, and to know that when you go low, that's what it feels like, and that everybody feels embarrassed, everybody feels shaky, everyone feels sweaty, and that you're not weak for feeling that way, that you're a normal human being. That's extremely powerful for people's mental health.
For sure. I One of our top listened episodes is one called "I Beep at Work," and it was literally about my Dexcom going off in the office and being like, "Oh, by the way, guys, I have type 1." I've since,
Mm,
obviously, since it's been like 8 years, going on 9 years for me with type 1. Like, I am, and I have a podcast. I'm very open about it. I always like to say I'm like that scene from Carrie running around with blood on my hands. Like, what's going on? I have type 1, but at least people know I have it now. But I think, what are some of your tips? And again, listeners, I did not really prep Dr. Heyman for any of these questions. So sorry for putting you on the spot with all these things. But I know your book, you talk about how to manage the stress of type 1
mhm.
when you're trying to like control it. I, what are some of your like high level tips, especially in the workplace? Like, I know that's a big stressor for a lot of us as adults with type 1 diabetes.
In terms of how do you manage type 1 in the workplace?
Yeah, like what about the stressors? Like, do you recommend patients have a plan? Do you recommend they tell their coworkers right away? Like, do you have any, what are, like, I guess my question is, what are the stressors that you hear most often from people, adults with type 1 in the workplace?
Yeah, so it's really embarrassment and being
Embarrassment.
self-conscious about their diabetes and feeling like diabetes is going to hold them back from getting promotions or from being respected. That people, other people's perception of them is going to be different, and that's an assumption. That's a story that you tell yourself. And I always encourage people to test that story. Maybe not dive full deep into the experience and go and say I had yell from the top of your lungs in the lunchroom that you had diabetes, but just if you're going to lunch with a coworker on your first day, just pull out your pump or pull out your pen and bolus. Don't say anything, but just do it and see if they ask questions. See if anybody even notices. I think so often I think so often we think that people are going to notice us for things that they probably won't even notice at all. And if you pulled out an insulin pump or a pen, someone may notice. Oh, she's giving herself a shot, but they're probably not going to ask. And 3 minutes later, they're gonna not going to remember what you just did. But in your mind, it's the biggest deal in the world, and it's gonna put a stigma on you for the rest of your life, and that's just not true. That's usually not true. But the only way to find out is to test it, and that's really true for not just in the workplace, but in all areas of your life, to test your assumptions about yourself and about other people and what their reaction to you is going to be. And so, and I think that it's important, a big topic that I talk about a lot in the book and in my work is boundaries. Boundaries with yourself with diabetes, and also boundaries with other people. And boundaries, we always think about that as keeping people out, but boundaries are also about letting people in, and doing it in a way that's going to keep you safe. That's going to keep you healthy. So you're not going to go and sit down with somebody the first time you meet them and tell them your entire life story, including your diabetes diagnosis, and about how awful your parents are, and all those types of things. If that's true, you're gonna meet someone. You're gonna reveal that information slowly as you get to trust them more. The same thing is true for diabetes in the workplace, or in the dating world, or wherever you are. Is you're gonna hopefully you can let people in test your assumptions about what their reaction will be, and then if you trust them more, to be able to, let them know more information. And then, of course, you want to keep yourself safe. And so we never want to have someone in a situation where nobody knows that they have diabetes, because, and then something happens, like they go low and they need help, and the people have no idea what to do, because that's really a safety issue. And we need to make
Right.
sure that, and you need to be safe emotionally, but you also need to be safe physically. And those two things work together. It's hard to be safe emotionally if you're not safe physically, and vice versa.
That's a very good point. We have had I vividly remember we had someone on the podcast who actually like didn't disclose in college that he was a type 1 diabetic, and he passed out like twice and his roommate had to call 911, and I was like, "But did you end up telling him?" And he was like, "No." And I was like, "Oh my god, I
Mm,
can't listen to to the rest of this
yeah.
episode slash even though I'm supposed to be talking about it."
Well, I
But
and and I want people to ask themselves. So I had a guest on my podcast last year, is a young lady who had dated a guy for a year, and never throughout that whole year that they dated, never told him that she had type 1. Now,
how?
I have no idea. I have no idea how she did it, but she was extremely secretive. And then she broke up with him, and she had now. And when we talked again, when we talked on the podcast, she was dating a new guy, and she wanted to know how to tell him. And so we were kind of prepped her to be able to have that conversation. It was an interview we did on the podcast. So you can go back and listen to it.
Yeah,
But
that sounds awesome.
one thing I had to ask her was, in that year that you're dating this guy and didn't tell him you had type 1, did you fool him? Like, did he? I'm sure that he knew. I can't imagine that somebody didn't know that. But second of all, how much work was that for you? How much focus did you have to put on hiding diabetes from him, as opposed to being open about it? And how much would that have made your relationship much more relaxed? And
And
you're
fruitful. You can lean
right,
on your partner and vice
exactly.
versa.
But having to think about hiding diabetes, it takes a lot of work. I mean, imagine that you went out with friends who didn't know you had diabetes, and you had to hide that. You had to go to the bathroom to give yourself insulin. You had to go to the bathroom to check your Dexcom. You had to do all those things. Like, think about, you're always thinking about, how can I hide this, as opposed to thinking about, how can I be here with my friends and have a good time. Like, it's a lot of work.
Right. And, I mean, I get it. I think that dating with diabetes is another hot topic on this podcast. And unfortunately, there are people in my past who haven't been the nicest about it, but that's just led me to people that are even more amazing. And, not everyone can be the most forthcoming with things, but I do think it takes a lot to work on it. But once you get there, like sharing that you're a diabetic, it can be very liberating for many reasons, but also like you said, safety is so important. I can't imagine. I live with my boyfriend now, and we moved in together in December, and we actually were talking about this last night. Apparently I told him on our first date that I was diabetic. We were getting
Mm.
coffee or something, and I think I whipped out my Omnipod PDM back in the day. Now I'm looping and it looks like a pager or something. And he was like, "You have a Blackberry?" And I was like, "No, you're going to feel really bad. I'm actually a type 1 diabetic." And he was like, "Oh, cool. Like, I'm one of my friends from college was type 1." And then, like it opens up a whole new thing. But now Matt is like literally just like dying to grab me a juice box, do anything for me when I'm low. And like I would have never found such a fruitful relationship had I not been open about that, because yeah, he's a great guy, but like it's really nice to be able to share some of the burden of diabetes with him. Not that I'm like giving him a burden, probably not the best word to say. I'm sure Dr. Schiffeldrum is probably listening to this like, no, we talked about this. But it's there's a lot that can be learned about yourself and from others when you share and disclose this disease. And I feel more comfortable that he knows, especially now that we're living together. So that would be my question for the person you had on your podcast. Like, how is that relationship supposed to progress? That's the
Well,
first
that
thing that comes out of my mind.
that one didn't, apparently, because they
Yeah.
broke up. But
Yeah.
hopefully
Very
the
true.
new one. I haven't talked to her about this, but hopefully the new one is progressing very well.
Well, we're all rooting for you. If you're listening to this, we're all rooting for you. But yeah, there's so much to talk about mental health and diabetes. I think diabulimia is definitely something I'd like to discuss another day. Maybe if we can have you back on, it's definitely its own episode worth for sure. But yeah, is there any? I'm trying to think. This I usually am much more smooth when I'm wrapping things up, but not today apparently. Um, is there anything else you wanted to touch on about your book or your podcast? Anything coming up?
Yeah. So a couple of things I want to share. So first is a piece of advice is people so often think that they can control diabetes. They can control whether or not they have diabetes, at least in their mind. They think if I can pretend like I don't have it, then it's not going to really exist for me. And you have to ask yourself, like, how realistic is that? And ask yourself, what about diabetes can I control? What about my emotions can I control? What about my blood sugars can I control? And if you find something that is controllable, then by all means dive in and try to control it. You can think about what you can control. You can control how much insulin you take. You can control what you eat. Control when you exercise. You have a lot of control about your behavior, but you don't have a lot of control. You don't always have a lot of control about how you're feeling, especially in the moment. And so, but when you try to control that, that just makes it much more challenging because you're fighting against a brick wall, and that brick wall is not going to move in the moment. So think about, basically it's kind of like the Serenity Prayer. Think about, I'm gonna screw it up, but know what you have control over, and know what you don't have control over, and focus on the things that you do have control over. Is really the thing that I want to emphasize. The other thing I want to let your listeners know about is that my organization, the Center for Diabetes and Mental Health, is putting on a big free virtual event on October the 6th, Thursday, October the 6th. It'll be from 4:30 to 6:30 Pacific time, so 7:30 to
9:30.
9:30 Eastern time. And this year we're focusing on your values in your life with diabetes. So both your diabetes values, I know it sounds a bit weird, but also the values you have in your life, and helping you to really move in that path, even though diabetes is with you. And so we're going to have an expert come on talking about how to identify and define your values. And then we're going to talk about lots of the challenges that get in the way of your values and give you a pathway to be able to still live out your values, even though you have diabetes. So keep an eye out for that event. It's completely free. You can go to www.reimaginet1d.com to register. It's not up right now, but that website should be up in a couple of weeks. So if when this podcast airs, it's not up, just check back. And we really look forward to seeing lots of people there. It's going to be a great event. We had one last year and it was phenomenal, and this year's going to be even better.
I love that. I will definitely be joining. I love virtual events. I'm still living in my semi-COVID bubble over here in New York because, now we have monkeypox and a recurrence of polio. So that's a whole other mental health discussion that I'm sure I'd love to talk to you about. But another boundary setting situation for sure. But yeah, if a free virtual event, sign us up. I will drop the URL in once the URL is live. This episode will be coming out well before then. Should be dropping tomorrow, but we will definitely give listeners, and we can link to it on our website when it's time.
Yeah.
So thank you so much, Dr. Heyman. It's been so interesting. I, again, eventually would love to hear more about your venture to Paris right after being diagnosed. But listeners, you can follow Dr. Heyman on Instagram at the Diabetes Psychologist.
Mhm.
Yeah, is that right? Yeah, there
That's
it is.
right.
At the Diabetes Psychologist on Instagram. You can follow us on Instagram at pancreas_pals. You can follow us on Facebook at pancreaspalspp. You can hit us up in our DMs. You can hit Dr. Heyman up in his DMs, I'm sure.
Yeah.
But probably not for free mental health advice. Anyways, definitely not. But I know Miriam gets that sometimes, so it's like SOS. But you can head to his website, CD as in dad or dog, mh.org. That's the Center for Diabetes and Mental Health. There's a lot of great resources there, so definitely check it out.
Yeah.
Thank you
And
so
actually
much.
the better resources are going to be the diabetespsychologist.com.
Oh, okay.
Yeah.
You heard it here, folks. The
The
diabetespsychologist.com.
diabetespsychologist.com. And if you want access to the book, you can either find it on Amazon or at the diabetespsychologist.com/book.
Amazing. Okay, cool. So thank you so much again, Dr. Heyman. We have more exciting episodes coming up of Pancreas Pals season 9. I can't believe it's season 9, and we don't have that many left, so it'll be season 10 before you know it. But thank you so much for listening, and thank you again, Dr. Heyman. Really appreciate it.
Thanks for having me.
Today's episode was brought to you by US Med Supply. Thanks for listening. Hey, Christy, have you heard of US Med Supply?
I think I've seen a commercial for it. It's a medical supply company, right?
Yeah, but apparently they're the #1 distributor for Freestyle Libre systems nationwide, the #1 specialty distributor for Omnipod Dash, and the #1 fastest growing tandem distributor nationwide. Plus, they're rated as the #1 distributor in Dexcom customer satisfaction surveys.
Ooh, sounds like something I need to check out. Do they partner with most insurance companies?
Yep, and they'll even help us get set up and work with our insurance companies so we don't have to spend hours on the phone.
The actual dream.
Right? We and all of our pals can head to usmed.com/pals or call 888-721-1516 to sign up now.
Already on their website.